Thank you all for coming to our talk on VR and addiction therapy. This webinar is jointly hosted by the USC Smart VR Center and the USC Institute for Addiction Science, which are funded by the USC Collaboration Fund. I will put the center's websites in the chat so that you can learn more about them and our events if you'd like to. Our speakers today are Heather Fry, who is the Clinical Director of Recovery Centers of America at Bracebridge Hall, and Alex Dussaud, who is a clinical psychologist at C2 Care. Our host is Eric Peterson, who is an Associate Professor of Psychiatry and Behavioral Science, as well as an IAS faculty member. And then during during their presentations, feel free to leave any questions you have in the chat, and Eric will compile them for the Q&A that's at the end. And with that, we can begin with Heather.
Great, thank you. Okay, so I'm going to share my screen. Well, I would like to share my screen. Oh, I think I got it. Perfect. So let me just kind of give an overview a little bit about Recovery Centers of America, just so you will have some context in terms of the patients that we are using the virtual reality program enhancement for. So I work at Bracebridge Hall, which is a satellite of Recovery Centers of America. We're located in Earlville, Maryland, which if you've never heard of Earlville, I would not be surprised. We are very close to Delaware, about an hour and a half from Philadelphia and Baltimore. So our patient population are adults. You have to be at least 18 years of age. There is no max age, both male and female, who are struggling with a substance use disorder. So they come into treatment usually needing a detox level of care. Often also they could be admitted as a residential patient, but they are struggling with a primary substance use disorder. Many of our patients also have co-occurring disorders, so they also struggle with a major depressive disorder or some other type of mood disorder or anxiety disorder. So we are using virtual reality as a program enhancement for those patients, for all of our patients. So RCA has partnered with Johns Hopkins University to offer VR sessions to our patients. So Johns Hopkins has created a program, which I will explain more, called Centered VR. And RCA has leased virtual reality goggles and noise canceling headphones from Hopkins. And we are facilitating Hopkins VR program of mindfulness through these headsets for our patients. So the treatment approach is focused on the practice of mindfulness. And what the intention is for these sessions to introduce, educate, and teach the patients these mindfulness strategies. Everyone can benefit from mindfulness. So when, patients ask, well, should I do this? Or, am I the right candidate? The answer is always yes, because every single individual on the planet can benefit from mindfulness. It is a practice that we all can use to help with impulse control, self-regulating your emotions, and managing your anxiety. And those are definitely the three top reasons that we use them for the patients in our program. So what is mindfulness? So this is a really important question to really understand, because we generally, what we're seeing is that when we tell patients, that we have this program enhancement and that VR is something that we're finding beneficial for the patients, they say, well, what is it for? And we explain, well, it's really a whole mindfulness program. It's a 6-series, 6-series session program that's really going to teach you about mindfulness, how to engage the strategies, how you can have it benefit your life and use it every day. And the patients say, well, I already know what mindfulness is. I'm already doing it. And then when you have to actually put it into words, what is mindfulness? If we were all to just sit here and think for a second, do I really understand what it is, right? Then it's really a different answer that we're seeing from our patients. So mindfulness really is the practice of meditation, right? It's really to be intensely aware of yourself and your environment, right? So what are my thoughts? How do I feel? And what are my bodily sensations? Hitting all of our five senses, what am I smelling? What does this taste like? How am I feeling about this? Am I hot? Am I cold? Really to be intensely aware of yourself and your environment is what mindfulness is. And for our patients specifically, they really do struggle, especially early on in treatment, with being in the moment. They have a lot of external distractions. They have a lot of internal distractions, because they're physically not feeling well because of potentially going through a detox process, or, they're struggling with family discord or legal issues, etc. So their thoughts are often somewhere else, So for them, they struggle often with being in the moment, in treatment, right now, being able to focus on what the content of the group is, or focus on how I'm really feeling. So our patients get referred for this full VR program, and they're referred primarily by their primary therapist. Any clinician can refer the patients to the program, but primarily it's something that they're discussing with their primary therapist, because as the therapist is doing their assessments and talking to them about their goals for treatment, and what their different areas are that they would like to work on, inevitably anxiety, mood, impulse control, comes up. And if one of those areas comes up, then VR would absolutely be something that we're talking to them about. So between these sessions that are completed, and I'm going to explain more about what these sessions look like also, the intention is for the patients to practice these mindfulness skills that they're learning and continue to practice the skills and process their experience. The VR sessions are actually facilitated by the yoga therapist and the music therapist. So any clinician, the way we're working it is that any clinician can facilitate a VR session with the patient, but patients that are referred for the entire 6 sessions, the full course of the program, generally work with either the yoga therapist or the music therapist for that program. The reason that we chose those 2 clinicians specifically is because they are already incorporating mindfulness, meditative practices, anxiety related coping skills and self-regulation, etc., in the content of the groups that they're already running. So this is second nature to them for sure. And when the patients meet with the yoga and music therapist for these VR sessions, they are also, engaging what else have you tried, what are you currently doing, and talking to them about coming to their groups and making sure that they're getting the most out of their treatment experience. Patients can certainly self-advocate for the VR program, and generally the patients that we are identifying and self-advocating for this enhancement is patients that say, I don't like how I feel. I drink alcohol because, it helps me with my anxiety. So these are patients that are identifying that their substance use is probably secondary, or as intended to self-regulate emotions, thoughts, feelings, and those patients would absolutely be appropriate for the VR sessions. Clinicians also use the VR for targeted clinical interventions. So oftentimes our patients struggle with staying in treatment for the entire duration of the program. And that's because, being in treatment is foreign to most patients. We have a lot of people who come in who are the very first time they've ever been in treatment. And being in a setting like this can be very uncomfortable for some people, especially patients who struggle with social anxiety. It can really be difficult for them to be in this setting where the majority of the programming is group therapy, and in situations where they are encouraged to share how they're feeling, process how they're feeling, meaning put their thoughts and feelings into words. So oftentimes we hear from patients, I don't want to be here anymore, because they're uncomfortable in treatment. This isn't for me, right? Which is, the patient that thinks that their treatment should be special in some way because their use isn't like other people's use, right? Or I've done all of this already. We often, like I said, get patients who are first time in treatment, but we have quite a few patients also who have been in treatment multiple times. And a lot of times with those patients, what we run into is that, coping skill groups, relapse prevention content groups, etc., may have been all content that they've heard before. And as clinicians, we know that every time you hear even the same thing, you're in a different place, you're at a different level of insight, likely, so it will resonate differently. Therefore, it's still, beneficial and relevant. But certainly, we run into the situation where, patients say, I've done all of this already. I already know these groups, etc. And the VR would absolutely be a different type of intervention than most of our patients are familiar with and have experience with. The VR sessions really are an immersive experience. So they really effectively change your current reality. So I don't know if any of you have had experience using a virtual reality headset, but when you put the headset on, it's a 360-degree, complete change in your environment. And with the VR that we're partnered with Hopkins to facilitate, the patients have the option of choosing which type of setting they would prefer. The settings range from a beach setting. There's a setting when you first initially start, the very first session is all the same. In that setting, you're kind of on the edge of a cliff. It looks almost as if you're in Europe somewhere, and it's beautiful and you're on the edge of the cliff. So we always tell patients, if you have a fear of heights, be prepared, because it definitely feels immersive. It feels like you are literally there. So the VR is a wonderful tool for us to use when the patient feels like they just don't want to physically be in this building anymore, because when they put the VR headset on, they don't feel like they are. They feel like they're wherever the setting is that they've chosen. So it really is an immersive experience where you're able to completely shut out the rest of the world, especially because you're also putting on these noise canceling headphones. So you can't hear anything else that's going on except for what is supposed to be happening through your session in the headset. The VR helps significantly to calm the nervous system. So it helps to, lower the patient's heart rate, to help them regulate their breathing, and focus on only what their current reality is, which is what's going on in the headset. So like I had mentioned, the Centered VR is the program that Hopkins has developed to facilitate these VR sessions and their specific Centered VR program. So the Centered VR really is, working to build people's resilience, to make their ability to handle stress more effective. It is built on, their experience in its evidence-based practice in mindfulness by Hopkins, like I had mentioned. The program is facilitated in a way where our clinicians are able to set patients up in their database and track what their progress is with these assessment tools that are integrated into each session. And I'll show you one of those assessment tools in just a moment. So we're really able to see, how the patient's perceived stress level is, hopefully decreasing as they're going through these programs. The program starts with Dr. Netta Gould, who is the director of the mindfulness program at Hopkins. And it starts with her really just explaining and educating what is mindfulness, like we talked about in the very beginning. So like I had mentioned, these settings also could be over a waterfall, by a campfire, in the woods, on a beach. And it really is an integrative, immersive experience, specifically individualized for the patient. So these 6 sessions are completed for each patient. The goal is that they complete all 6. Depends on when they start the VR program in relation to their length of stay. Sometimes patients, for whatever reason, don't start the program maybe until week 2. So they only have 2 weeks left of treatment here, and they may not get through the entire 6 sessions. It's ideal if they do, but certainly the goal for us is that we are introducing patients to mindfulness in a way that they likely would not have otherwise been introduced to it. The 6 sessions are broken down here: introduction to mindfulness and the power of VR, introduction to meditation and mindfulness of breath, mindfulness of breath, body, and sound, seeing meditation, which is really mindfulness completely based on visual cues, mindfulness of breath, body, sound, thoughts, and choiceless awareness, and then mindfulness of chosen anchor. So these are the main points or the main concepts that are introduced in each of these 6 sessions. Each session takes about a half an hour. So the patient is sitting, with the clinician, completely immersed with the goggles and their noise canceling headphones on for a minimum of 30 minutes. And then generally they have, 15 minutes before and after where they're talking to the clinician who's facilitating it about what, has been going on, how they've been doing with practicing the skill learned last time in between sessions, and then the follow-up of what their homework will be after the session is complete. 3 out of the 6 sessions have this perceived stress scale that is assessed with the patient at the beginning of the session. So we use this perceived stress scale to track the patient's perceived level of stress through the course of their sessions. And like I said, the goal is that we're seeing a decrease in their level of stress. And we're also seeing that manifest in a decrease in the behaviors potentially that the patient could be displaying through the course of their treatment. For instance, their ability to handle, mild disagreement with a peer, or being challenged by their therapist to do something that makes them uncomfortable. If they have social anxiety, for example, their ability to handle or tolerate the length of time in group, the ability to share during group, etc. So the goal is that we're seeing these perceived stress scale and assessment scores decrease over time, but that we're also able to see the manifestations in their behavior during the course of their treatment. So what we've seen so far, this is the data that we have. We launched this VR program enhancement in November of last year. In the month of November, we had 16 patients who participated in the VR program. Their average length of stay, it was 25 days. So in order to really complete treatment here at Bracebridge Hall, patients stay a full 30 days. They discharge on the 31st day. And what that means, treatment complete, is that they have gone through the entire course of content and curriculum during their episode or during their length of stay with us. So our average length of stay for patients in general is about 22 days. So we are definitely seeing patients stay in treatment longer and definitely better able to tolerate the anxieties and fluctuations in their emotions and anxiety levels that happen throughout treatment for patients that are participating in this program. So 5-month data from November through the end of last month in March, we had 82 patients completely participate in the program. And from those 82 patients, their length of stay averaged at 28 days, which was really, significant for us. Out of all of those 82 patients, only 3 of them left against advice. And when patients leave against advice, what that means is that they are impulsively saying that I cannot tolerate being here anymore, and I'm leaving, which typically looks like, them arranging their transportation and us trying to engage their families encouraging them to stay in treatment. And the outcome being that they leave despite all of those interventions. So out of 82 patients, 3 leaving against advice is data that we're very pleased with. Right now in April, we have 14 patients who are currently participating in our VR program. So in closing from my presentation, so this treatment approach is totally, focused on the practice of mindfulness. We are working with these patients diligently on anxiety as a identified problem, which is leading to barriers with them being able to sustain their recovery. Everyone can benefit from mindfulness. So, we find ourselves as the clinicians, talking to, each other about mindfulness strategies and using the verbiage from the mindfulness program. And really the goal for these patients who are participating is that we are able to align the strategies with how they will use the strategies to sustain their recovery. So for our patients, they often struggle with cravings for their substance, cravings for alcohol, etc. And those cravings can look so very different for every single person. So we really use the mindfulness program and the VR to help the patients to acknowledge and understand how they're feeling and what their thoughts are like, and recognize when those thoughts and feelings are changing, to be acutely in tune with themselves. So that way they're able to better identify when they are experiencing cravings, which they may have previously disregarded as something, completely justifiable, right? The patients are really able to self-regulate when the cravings do occur, right? Because they're able to sit with the craving, know that it is a thought or a feeling that will pass, and be in touch with themselves and understand it. We know that patients in general, people, when we understand why we feel the way we feel, or even how we feel, we're so much better able to tolerate it. Mindfulness, the VR program, is helping our patients to manage those intense emotions. For us, our patients definitely, all of their emotions are more intense when they're early in recovery, because the substances have been dulling those, emotions for quite some time before they enter treatment. So when those emotions come back, just the variation in no emotions to now having emotions can create this perception that the emotions are very intense, So the mindfulness strategies really help the patients to manage when they do feel those intense emotions come on, and just to stay in the moment, to really manage and be able to tolerate those urges to be impulsive, which can definitely lead to relapse. Just staying in the moment, being able to identify how they feel, what their thoughts are, where they are, their environment, all of those things, and really to use the mindfulness strategies to cope with life and cope with their anxieties and things that will come up because life is stressful, and really to avoid relapse and help them sustain their recovery. That's it for me. So I'm happy to answer questions at the end of the program.
Great, thank you so much, Heather. Next, we have Alex presenting on C2 Care.
Hi, everyone. So I'm Alexandre Dussault. I'm a clinical psychologist working at C2 Care. So C2 Care is a company who specializes in creating softwares for VR therapy, not just addiction. But since today we're focusing on addiction, I'm going to show you the process that we follow, and also some of our tools. So I'm going to share my screen. Okay, great. So first, a little theory part about why it's working and how it's working. So most of the time, the process of addiction is process of conditioning. So if you present a cigarette to someone who's never smoked before, there was no previous pleasure associated with that cigarette, so there is no craving. Someone who has smoked before is going to have some pleasure from that smoking, and so the pleasure is conditioned with the item, with the cigarette. And so seeing a cigarette might induce some craving. And the craving can really be associated with anything, the cigarette in itself, or the environment, or the moment of the day, or the activity you're doing. So there's a lot of items that can be associated with craving. And so what we are going to do at C2Care with our software is deconditioning. So the first exposure, the craving is really hard. You expose the patient to the cigarette, but the patient is not allowed to smoke the cigarette, so there is no pleasure. And the second time, the craving is a little less intense. And with many exposure sessions, at the end, the brain has forgotten the association between the cigarette and the pleasure. And so the conditioned pleasure is deconditioned. So the patient will be presented with a cigarette or another craving cue, and there will be no craving where there was before. So at C2Care, regarding addictions, we have 4 main themes. So we have tobacco addiction, alcohol addiction, drugs addiction, and gambling addiction. And we have 3 environment formats. So we have 360 pictures. They're not moving, there is no sound, there is no interactivity, but sometimes it's enough to start with the craving. So here, for example, is a place where you can buy tobacco and cigarettes. And you can also work on the craving you get when you go there to buy something else, because it's typically in France, a place where we can buy many other things. You have 360 videos, so that we have filmed ourselves in many environments associated with drinking and smoking. And so with those videos, you're also able to work on environmental cues, the people drinking around you, the sound of the bar, the music, that kind of stuff. And finally, one of the most interesting tools we have, in my opinion, is the 3 environments. The 3 environments are very interesting because they allow the patient to manipulate the object of their craving, and so to reproduce all the movements and the rituals that they have associated with the consummation of their substance or their behavior. And so as you can see in these screenshots, the patient can grab the cigarette and the lighter, and he can do the movement that usually just to light it up, and bring the cigarette to his lips, and do all these movements that usually induce a lot of pleasure. And that's why these movements and these behaviors are highly conditioned with craving. And so by doing so, the patient will slowly extinct their craving. In terms of environment, for drugs, we have environment for cocaine, crack, and cannabis. And we have tried to find the most important movements and rituals in this type of addiction problem that the patient will be able to redo in VR. And thanks to the sense of immersion and the sense of presence that VR offers, this tool is really useful for exposure therapy with sometimes, well, substance that you cannot bring into a mental health institution. And so the patient will be able to do all the movements and move around. And what we saw in this one is also a party mode. So there are people and music and food. And so you're not just focusing on the substance itself, but everything regarding the substance usage. So every tool that I've shown you till then is C2 Addict. It's our main app to treat addiction. But addiction is not just treatment of the substance through exposure therapy. There's a lot of things that you can work around, and we have many tools for that. So for example, C2 phobia is used to treat anxious disorders, phobias, but not only, and can also be used to work on psychosocial behaviors, being able to go to the supermarket, to take the metro, the bus, all these behaviors that can be altered by the use and abuse of substance. You can train your patient again at first in VR to deal more easily with these situations. C2 Hypno is made of environments made for relaxation, mindfulness, and hypnosis, hypnotherapy. So like other in our presentation, these environments are made to be really relaxing. We have a wide variety so that patients can choose them from what they like best and really use that to also calm the craving at the end of the exposure therapy on the exposure session, because there's always a bit of craving remaining. And that bit of craving is sometimes enough to induce consumption behind it. So we always end our exposure therapy sessions with some relaxation so that we kill every single bit of craving remaining and the patient is not tempted to go find a cigarette or drink or drugs after the session. C2 Brain and C2 Neuro can be used to work with patients whose substance misuse has damaged their cognitive abilities. So we can work on memory, we can work on impulsivity, on adaptation. So many of these skills that are required in every area of life, we can work with them in VR. C2 Brain will be more about games, memory games, for example, and C2 Neuro will be more about real life environment like a supermarket, for example. And finally, in case your patient requires something more specific that we might not have developed yet, C2 Custom allows to use your own resources, either 360 videos or pictures for a more specific environment or more specific substance. You can still use them in VR thanks to C2 Custom. And what I wanted to show you was our interface, because as you see, this is the interface to control the cigarette session, the cigarette environment. And as you can see, you can add many, many cues. So for example, the coffee, because a lot of people like to smoke a cigarette while they're drinking coffee, or add music, or the party mode that I was talking about earlier. The cigarette can be a classic cigarette or a rolled one. It can be lighted or off. The newspaper. So all of these cues that your patient might say to you, yeah, I don't have a problem not smoking during the day, but when I'm drinking my coffee, it's really, really hard not to smoke a cigarette with that. You can work on that very specific cue and that very specific moment to help your patient get rid of their addiction. So the global settings will be to help your patient with feeling in the situation, the right height, the right skin color. And you also have breathing help. Sometimes the craving can also induce anxiety, very bad physical sensations, strong heartbeat, for example. So you can use the breathing help to do relaxation during the session when the craving might get too hard to overcome. And on the contrary, when your patient says that these kind of symptoms that are often associated with anxiety lead them to use substance, you can expose them to a strong heartbeat and a heavy breathing. And that will probably induce anxiety. And the anxiety will induce the need to use cigarette or drugs or alcohol. And so that craving that is very specific and associated with that emotion, you can also expose them to that. And so as you can see in our tobacco, we have all these environments I was talking about, the videos, the picture, and the 3D environments at day and also at night, because some patients will not smoke or drink during the day, but have much more trouble restraining themselves at night. So our goal is always to find the more cues that we can add to our environments so that the therapist has the most control possible on the environment and on the exposure to allow the patient to fully explore what their craving means and how it affects their lives, and to be sure that no situation is left untouched, and also to teach the patient that craving will not last. Their craving will always come down at some point. And so that if you take the time to do your relaxation and slow breathing, and that you focus on the craving decreasing, you will be able to overcome the addiction and not to relapse or to prevent relapsing. I might have been a bit quick with the presentation, but I think I've said everything I had to say, so maybe that leaves more time for more questions.
Okay, great. Thank you both so much. So, I mean, I can just start by saying this is really amazing stuff. Like, it's so cool to see, you know, the actual images and the videos that you show and hear about, you know, how VR is able to help individuals who are struggling with addictions. So if I have a couple questions, and there's been already some that have popped up in the chat. So as questions come up for everybody, if you can throw them in there, that'd be helpful. I will read them unless you want to ask the question yourself, which I think you're able to raise your hand or just let me know in the chat that you want to read the question. Okay, so maybe we'll start with Heather. So really, really cool stuff, Heather. Great work you guys are doing. You had mentioned that this is one of the questions from the chat and one that I had as well. So you'd mentioned that you have some outcomes for some of the individuals that are using the VR headsets, and particularly mentioned cravings. You said that patients experience fewer cravings and might have good outcomes after using the VR devices. We were wondering if you had any data on that, maybe collect any data on cravings over time to see, are these cravings actually decreasing by some kind of standardized measurement for the patients you have?
So we haven't collected, so to be completely transparent, we have not collected data specifically on cravings as patients are going through the program in a way that we're able to capture it quantifiably for you for that purpose. Monitoring cravings is something that we do throughout the course of the patient's treatment. So it is a question that they are frequently asked by their therapist, by other clinicians they come in contact with, but it is not something that we've tracked specifically.
Okay, thank you. So then let's go over to Alexander. If you, this is a question I had as well. It looks like Kira was also thinking it too. So you may have said it, but I might have missed it. In terms of how many sessions or the length of times that people engage in these 3D environments to when you start to see some progress in terms of their decreased craving. So I guess you could start with, you know, what is the average length? You know, what would be a course of you know, the VR sessions, but then at what point do you start to see some reductions in the craving?
Okay. So what we try to manage is to limit the session, one session of full exposure to around 20 minutes. So we don't get too high in the cravings. We do a hierarchy of the situations that are problematic to the patient. And we start with the lowest one, so that the patient is not in too much difficulty. And with that, we are able to do around 20 minutes of exposure. And after 20 minutes, the craving is low enough that we can stop and move on to relaxation. For some patients, it can go much longer, around 40, 45. Sometimes it can go up to an hour, but that's very rare, and that's when you go very, very high in terms of craving. In terms of the number of sessions, it's really hard to say because it really depends on the type of addiction, the type of substance, the number of situations. So we don't really have numbers on how many sessions are needed to fully extinct a craving. if you apply some kind of parallel between anxiety exposure and the extinction of anxiety, you are around 10 sessions for a full deconditioning of the situation. I would think that it's a bit more for addiction because the situations are wider and cover more cues. So it might take longer for that.
Gotcha. Yeah. And then a follow-up question for that is, I mean, so does the individual identify the, the risky situations that are most pertinent to them? So, when I go to the store and I see cigarettes, that's when it's hardest for me. And then, so we use sessions focused on the store, but then they're also like, yeah, but it's also, coffee in the morning. So you would do a bunch of different scenarios for that person.
Yes, you're going to do a bunch of different scenarios. So let's say that going to the store and see cigarettes is 10% difficulty, but drinking a coffee is going to be 50%. You're going to go over all this, most situations in the hierarchy, because usually when you reach the 100% of difficulty, all the situations under can be covered. And even if you get craving, we know how to manage it. So if, to stay in the cigarette, 100%, it means that in that situation, I am 100% sure that I'm going to smoke a cigarette. And that situation is being in a party with friends and music and alcohol. Then when you reach that level, the craving is allegedly the strongest. So if you are able to manage your strongest craving, then all the other cravings, you have the tools and you have developed the tools to deal with them and to do your own exposure in real life and to path them and let them go.
Cool. Yeah, and I also wondered, because it sounds like you with addictions treatment, often, I know you're trained in CBT, often it's the deconditioning piece, learning how to be in these situations without, let's say it's driving. So, learning how to drive a car without smoking a cigarette. But then there's also like replacement behaviors. And you talked about, mindful breathing. I mean, it sounds very similar to what Heather was talking about too, with some of the mindfulness techniques. Is there also pieces within the therapy where you talk about some of these alternate strategies that people can use, like, don't go to that store where they have all those cigarettes behind the counter, or, when you're driving your car, hold a pencil in your hand, things like that?
Absolutely. C2 Addict is not a full therapy, it's just a tool. So you're going to use it to manage craving, but addiction is not just a craving, it's many other things. So you are going to use C2 Addict and VR in your therapy, but you're going to cover many other things with your patient that are going to help them overcome addiction. So relapse prevention strategies, how to avoid the situations that are going to cause them to relapse, how to deal with the relapse if it happens, because usually relapse is the rule, not the exception. So you cover all that range, and C2 Addict is just another tool for therapists to help patients with addiction to deal with their cravings better and to help the craving get reduced and the need to, or the want, not the need, but the want to use that substance to be less.
Cool. Yep. That's great. It's such cool stuff. All right, I've got a couple more questions for you, but let's go back to Heather for a minute. So Heather, with the the practice of mindfulness, and I've tried to practice mindfulness here and there, and then I always have these periods where it's going really well, and then kind of forget about it, and then try to get back into it. My understanding of mindfulness is that it's something you learn, but that it's something that you need to practice over time and continue to do it. And every time you do it, you get a little bit better, and sometimes you have slips here and there. So I wondered if you could talk a little bit about these 6 sessions that they have, which are kind of just like the perfect setting for mindfulness, where they're completely distracted and completely immersed, and then how that could translate to longer sustained practice. And if you have talked with any patients about what that's like to go from this completely immersive experience to then, sitting in a living room or at the bus stop where there's a ton of noise around them to try to practice mindfulness.
Sure. So that's a great question. So we have, the way that our program is set up, most patients have a roommate, but they are otherwise assigned to a room that's a very comfortable space, where they can, dim the lights and control the environment to most degrees, right? So the goal would be they're in this immersive experience when they're wearing the goggles and they're going through the session, and then in between sessions, however long that is, a couple of days or 4 or 5 days, etc. They're putting themselves in these situations where they're able to practice the skills. So building their own environment, adjusting things in their room, where they're able to practice the skills and do that for a period of time, and then try to practice the skill while you're sitting in small group, where there may be like 8 other patients with you, and then practice the skill when you're in the larger group, where there may be 25 patients with you, and then at a speaker meeting, so you're progressively increasing the amount of environmental stimuli you have at the time where you're supposed to be engaging this mindfulness skill, and it's really about building the habit of mindfulness, because they've unfortunately developed habits that have become unhealthy for them, and no longer working to meet their need, right? Because the consequences are greater than the reward. And now the goal is that they're doing the mindfulness so much that it's now becoming a habit. When they start to feel anxious or they start to feel overwhelmed, that they go to these strategies, as they would previously go to the substance. I hope that answers your question. I did have a quick question for Alexander, if you don't mind. I noticed that when he brought up the platform that he was using, that it said at the top, something like sensor attached or something. And I'm wondering if during the sessions that he's doing with the C2 addict, if the patient is connected to some sort of biofeedback mechanism that you're really able to see what the patient's vitals are during the session.
So yes, with I don't remember if it's with the wireless or with the wires headset, but you can plug heartbeat sensors to do biofeedback during the session. So you're able to do that with the software. Yes.
That's awesome. That's really great, because then I'm assuming that over time you're able to show the patient that their heart rate has decreased in the same environment circumstance. That's great.
Yes, exactly. Okay. You can show them that their response, even if they might have trouble seeing it, that their response is less and less, and their body is reacting less to the substance and the situations.
That's amazing. That's awesome. That's what we're seeing too with our perceived stress scale that the patients are completing through the 6 sessions, is that their perception is that they're still feeling anxious, right? But then when we show them, but look, your score last time was twice as high as your score this time, it's kind of like this, oh, like I am getting better. Oh, this does work, response, which is really incredible for the patients. So.
Yeah, because when you're caught in the moment, you're feeling the craving, you don't have the mental space to think about what happened last time, how you felt last time.
Right.
And after it's done, you're just exhausted because it's a very difficult exercise, exposure. So you have that data to show them that, yes, it works. And here is your progress. And I think it's extremely rewarding for them too.
Yeah, I mean, that type of biofeedback is really key. And you also, correct me if I'm wrong, but it also sounded like you had a way to kind of help simulate like an anxious response by having a loud heartbeat in their ears. Was that what that was, or loud breathing?
Yeah, both of them, yes.
Oh, that's cool. So as you were talking, I was thinking, I mean, you've got the situational and the environmental cues, even like down to like the social environment, and then, the rituals that they have, and then even, some of these risky emotional states too, which for many people would be anxiety. I don't know how you do. I don't know if you guys have thought about this, but like any ideas on how you could kind of try to simulate, that depressed feeling, or kind of just that, I don't know how other way to say it, but like when people get the F-its, where it's just like, like I've been sober for so long, but it's just things are so bad, like, forget it. I'm just going to go ahead and use.
Okay. Well, in that case, so you could either find in VR environments that are creating depressive thoughts. So we have an app called C2 Maps where you can see Google Street View in VR. So if there are specific places that bring back bad memories that can be associated with depressive episodes, you can do that in VR. Or you can find, I think there are some videos online so that you can use with it custom that are very hard emotionally and can induce the feelings that you get during depressive episodes. So that's a risky game, and I would not advise it for any patient and for any therapist. But if you want to expose your patient to the craving that the patient gets with this episode and this state of mind, it is possible, yes. But it's something that you need to be very careful with and make sure that you have a very good follow-up with the patient.
Cool. Yeah, that's great. Thank you. So there's another question for you, Alexander, about are you able to combine some of the various types of the software? So for example, the Hypno and the Addict one?
So I'm not sure I understand the question completely. You can use both apps during the same session, but there are two separate apps. So you will need to close Addict and start Hypno, for example, to use them both. But yes, it's encouraged to use them both during a session, one after the other. I don't know if that was the question.
Yeah. Okay. Okay, let's go back to Heather, and we're getting almost to time, so we'll start to wrap up soon. If anybody has any final questions, please let us know. This is a very specific question, but I'm just interested to hear. So, just looking at the headset, it's very immersive. Everything's blocked out. I wonder, I work with veterans that are struggling with post-traumatic stress disorder. And I know that some people, even at USC, Skip Rizzo, and have done some, PTSD treatment with these individuals. And I haven't picked his brain about this too much, but I'm wondering what you think, just in terms of like, for people that have high levels of anxiety, maybe PTSD, about putting on this device, in a room, maybe their therapist is there, but just completely blocking out the world and not being able to see what else is going on. What are some things that the therapist might do to work with somebody like that who's pretty apprehensive about doing that?
I feel like you would probably need to just condition them to be comfortable with it, to be honest. I think that to start certainly with the expectation that they would complete the whole session, would be unrealistic. For our patients, we've had patients who have psychotic disorders also. And for those patients, they are already out of touch with reality. So putting them in another immersive environment, which is totally another third reality, was challenging. And those were the patients that struggled the most with this technology. We certainly have had patients too who have PTSD and struggle with, being too vigilant to allow themselves the vulnerability of being immersed in another reality. But, we just have to work with them, and we just use it. Let's just put it on to see how it feels, right? This is such a cool, experience. I don't want you to miss out. Let's just put it on until you're ready to take it off, and then can we get through the introduction part of it? And it's just a progressive, building up the amount of time that they're able to tolerate having the headset on. And certainly, doing it in an environment where they feel most comfortable. So for us, we have the luxury. Our facility sits on 500 acres. It's beautiful. We're on the river, so it's not in the middle of the city where there's a lot going on here anyway. So I think that's to our benefit that the patients feel safer here. But certainly I think it would depend on, the environment of your office too,
Sure.
Yeah.
I mean, what I'm hearing both of you say is that this is, it's an amazing tool that is one of the, pieces in your tool set that you would then use to work with patients. So, you know, I've been doing some stuff with mobile apps and websites and trying to, you know, help individuals with addictions without any contact with, you know, a therapist at all. Because I think those are great ways to reach people that, you know, wouldn't even consider it. But, you know, it's so important, you know, for there to be some type of support person there, whether that be a therapist or somebody else in the family that can help them with navigate some of these things. Because there's no magic bullet yet, but these are amazing, innovative tools that we have to help people.
They are. And I would just say real quick, just two things that come to mind when you were just saying that. One is that we're finding this to be very successful with our young adult population.
Oh, cool.
You know, the young adults who are not going to yoga because that would never work for me, you know. But this for them is more of like a video game, you know, so they're intrigued by this and it feels different. So it feels like special, you know. So the goal with the young adults really is to just give them some exposure to mindfulness so that they can see the benefit, and then we work with that momentum, you know, where if I ask them to go to a mindfulness group or to go to yoga, which is offered 7 days a week, you know, they declined, you know. So It's really exposing them to something that they, like you said, would otherwise have not taken advantage of, you know. So that's what I think is most important for us, for sure.
That's great. Okay. So I think, why don't we wrap up? We have your contact information, which I think Kira will send out if people have any follow-up questions. Let's see. I'm going to paste in our the Smart VR YouTube channel link if people want to watch this after the fact or share it with friends. But yeah, I want to thank you both so much for being here. I mean, this is such cool stuff, and we're excited to see, you know, maybe have you back in the future to talk about this and see where things are at in a year or so.
Sounds great. Thank you so much for hosting. I appreciate it.
Thank you a lot.
Thanks so much. And thanks, Kira. Take care, everyone.
All right. Bye-bye.
Bye.
Goodbye.